Join me as we explore the journey of internationally educated nursing academics, their challenges and triumphs, right here on Nurses Beyond Borders podcast. I'm your host Joshi, and I'm thrilled to have you with us. Today, we have a truly remarkable guest with us, someone whose dedication and passion for mental health care has made a real difference across 2 continents. Joining us is Ebenezer, a registered mental health nurse with over 13 years of experience, a proud Ghanaian, trained in Ghana, and has worked extensively in both Ghana and the UK, bringing expertise to a wide range of mental health services. From mental health assessment units to forensic mental health services, and from community mental health to adult learning disabilities, his wealth of knowledge is undeniable. Currently, Ebenezer is shaping the next generation of mental health professionals as a lecturer in mental health nursing, guiding students in evidence-based interventions and integrated mental health care. Years ago, he led a groundbreaking mental health awareness campaign in Ghana in collaboration with the World Health Organization, bringing education, support, and hope to schools, radio, and TV audiences, changing lives in the process. With experience supporting refugees in Ghana and championing patient-centered care in the UK, Ebenezer has left a lasting impact on countless individuals. Today, Ebenezer is joining us to share his journey, insights, and passion for mental health nursing. Welcome, Ebenezer. I'm so glad to have you today with our podcast.
Thank you, and thank you for having me onto this podcast.
Thanks, Ebenezer. That is an incredible journey across 2 big continents. So, what made you choose nursing?
Thank you so much for this opportunity. First of all, I'll say that it came accidentally. It wasn't something that right from high school I'd wanted to be a nurse.
Okay.
So I was initially aspiring to be a laboratory scientist.
Okay.
So after my secondary education, the result came up, and then I couldn't meet the grade to qualify me to read medical laboratory scientist. So I was encouraged and advised that, okay, you can even do nursing with your grades. And that's how it happened. So I got enrolled into mental health nursing by the recommendation of my senior brother. I didn't really know what was into that specific field. Then when I got in, I realized that, oh, okay, I think I love this. This is something that I really, really want to do the rest of my life. And I just developed a passion going on the ward in those days, seeing how people were being supported by the mental health nurses, seeing the impact that they were making and putting smiles on people's faces. I just thought I'm in the right place, and I never regretted being in the mental health nursing profession. So yeah, that's how we started those years back. I could have done something else, but I think for me it wasn't a mistake getting there, even though I had not thought of it initially. But when I got into it, I felt like, oh, I can do this, and this is something that I love doing. And it's been a very interesting and amazing journey all these years as a mental health nurse. Yeah.
Excellent. So you did your undergraduation in Ghana?
Yeah, so I started my journey as a diploma in mental health nursing program, for which was 3 years with 1 year internship. So that was like 4 years.
Okay.
Then when I finished the program, my first unit was an assessment unit. But then I realized that I had a passion to educate and sensitize people on the awareness of mental illness. And back in Ghana, people's perception about mental health is something else. They mostly believe that mental health is being caused by spiritual causes. So sometimes when people are ill, they do not take them to the hospitals first of all. They believe that it's as a result of a spiritual problem or a case, or so they would first of all take them to the prayer camps for them to be prayed for. And the conditions within the prayer camps weren't that great. So we had some people coming into the hospital from the prayer camp whose condition have deteriorated. And I realized that there was something that wasn't right. So I started to develop the passion to sensitize and to create the awareness about mental illness. So through that, I went and did a 2-year community mental health nursing program and as a bachelor degree. So finishing that, then I came back to my hospital, leading me to the community, more of awareness creation, sensitization. So we were going to the primary schools, the secondary schools. We were educating people on the causes of mental illnesses. We're also dealing with substance misuse, because it was actually increasing among the school growing population. So we went there to educate people that, you know what, when you involve yourself in abusing drugs and stuff, you probably develop a mental health condition later on in your life. So the awareness and the passion spark up at the time. And then didn't just end in the secondary schools and the basic schools. We also went to the radio stations. And that was where I realized that the knowledge of most people, or a lot of people around in the communities, were quite low about mental illnesses. So sometimes on the radio stations, you have people phoning in and asking questions that you might think that they know, and surprisingly, they didn't know. So it led to us organizing what we call a community debate. So we were now sending the mental health services right to their doorsteps in the community, where we arrange, get people together, and then we educate them, sometimes through role play, through drama, through health education, and then we do some sort of health screening. And whilst we're doing that, we actually encourage them to report to the hospital whenever they're having any psychological problem. It was quite common for people to visit a general hospital when they're feeling ill, or when they are suffering from any physical condition. But the stigma with mental illness was something that was quite increasing. So people felt ashamed talking about their mental health issues. People were not comfortable discussing when they're feeling stressed and they think that their behaviors are changing and stuff. So it was a very huge role and impact I played at the time. And from the knowledge I gained from my BSc Community Mental Health Nursing, it really empowered me to do more. And that led to me being enrolled in the WHO Quality Right Initiative program in Ghana, where it was on a larger scale, on television stations, on radio stations, in schools, and just campaigning. And I found that very satisfactory, and I gained so much joy when you've given people the information that they need, and they were like, oh, how come we've not got this all this while? And through that, a lot of people, even from early signs of them suffering from mental illnesses, were able to get into the hospital quite early for them to receive treatment, diagnosis and treatment. And it really reduced or just minimize the complications that they probably were going to suffer if they've not gotten that kind of information. So yeah, that is how it started, building myself from a diploma, degree, and then also into the community and then sensitization program with the WHO. Yeah.
Wow, that was an impactful journey, I would say.
Absolutely.
And yes, yeah.
Absolutely.
So you made a major impact in the mental health services there.
Absolutely.
And what made you then decide to move across the continent?
So after my first degree, I realized that there was so much that I could actually do. So I was looking for the opportunity to actually progress as a mental health nurse. Then I got the opportunity to come to the UK at the time. In the UK, my first service was in an adult learning disability. And there was another level of experience where it was quite different from the services that I've worked in for the past years back in Ghana. But then I realized that, okay, those people who were suffering or who were diagnosed as having learning disabilities in that service were sort of being restricted in some of the things that they actually do. And it happened that the service were actually depending so much on agency nurses, then they didn't have regular or permanent nurses on there. So there were a lot of things that were going on which weren't right, and they had depended on support staff to deliver the care that nurses were actually going to deliver. So when I got in, I just tried as much as I can to understand the system, the culture, and then understand how their processes work. And then through our delivery of services and then working with the team, we were able to minimize the level of restrictions that were imposed on the patient. For instance, in those days when a patient becomes aggressive, it was much common for you to see them straight away secluding the patient and leaving them for longer hours. But when we came in, realized that, okay, it's not always about secluding the patient, but there are other therapies and treatment that you can actually bring on board to minimize the level of incident and the level of injuries that staff were sustaining as a result of restraining the patient. And it actually impacted on the life of the patient, and even the staff as well got to understood that it's not always about being restrictive, but understanding the choices and preference of the patient and supporting them to live a better quality of life. So the motivation was for me to gain more experience and knowledge. And when I came to the UK, I did my master's in mental health as well. As I said, I just wanted to progress alongside mental health, and I wasn't ready for any other specialty. So I did my master's, and through that as well, I gained more knowledge and experience working with people with mental health issues. And it was a nice experience those years back in down South London.
Yeah, that's great. Thanks for sharing this, Ebenezer. So, you said you worked, it was a big shift for you, isn't it?
Absolutely.
From the practices you are trained to coming to a completely new healthcare system. What were the challenges and the opportunities? Were you working in the NHS, did you say?
Yes.
So, in the NHS, what were the opportunities for you, and what were the challenges as well?
Thank you. So I think the challenge was, first of all, with the culture shock.
Yes.
Coming from the point where I was actually much involved in educating people about the use of substances and stuff. So we were talking about a lot of hard drugs and stuff that people were abusing. And then my first culture shock I had was when I was on the ward and you have your staff coming to you to ask for permission to go and then have a vape or and smoke and then come back. And to me, I was like, oh no, this is not something that from my background you couldn't openly talk about you wanting to go and smoke when you are on duty or when you are at work. But it was something that people were just coming to me because I was the nurse in charge on the ward, and they would always come to me that I want to go and have a smoke break for. I'm like, is that what goes on over here? I was actually, I'm shocked knowing and hearing about that. But with time, I got to understand that, okay, that is how things work over here. The other thing was another challenge that I think I did encounter in my initial journey was the team that I came to meet didn't seem to understand me quite well from my initial journey. And the reason being that they had worked with the patient for so long a time, for several years, and then from nowhere they see you coming in. They were the ones that did orientation, show you the facilities, and then the next moment they are taking instructions from you. That was a challenge, and they felt like, oh, we know the patient better than you know, and we're able to identify. And of course, they've worked several years with the patient. However, what they were actually doing were not in line with what the nursing practice or what we would do as nurses. And because the service has not made use of regular nurses and they would just depend on agency nurses, they come in, do their normal duties, and then they go. So you didn't have people who really, nurses on the ward, who really were taking full responsibility. For that reason, I would say the support staff were, I wouldn't say over-empowered, but they were operating beyond their scope of practice. So they were doing things that they weren't supposed to do. They were deciding where patients were supposed to go into seclusion and when patients were supposed to be terminated from seclusion, and that was purely the role of the nurse. So when we came in and we were trying to put our foot down to say that no, this patient doesn't need to go to seclusion. Previously, they would have straight away sent the patient to seclusion after that restraint. But we were like, no, the patient has been restrained. The patient has been given some medication, sedated. Why would you seclude a sedated patient? He's already sedated. Why do we not take him to his room or make him take him to the quiet room to give him a relaxing environment. So they weren't so much in agreement with me initially, and they felt like they were being stripped of their powers or their control. So it brought a lot of rifts among us, and I had some of my colleagues who came and they felt like they weren't able to work within the service, so some of them left.
Okay.
But we stood our ground, and initially management were also not understanding, but when they realized that the number of incidents and injuries to staff had really declined, then they started understanding the point where we're coming from, because they were used to that particular culture, way of doing things for a very long time, and all of a sudden we came in and we felt like our pains are at risk. I need to justify why I am taking this patient to seclusion, so I'm not just going to sit down for you to decide and then I'll be responsible for that. So it brought a lot of issues here and there, but with time, with conversations and stuff, and at some point they would bypass you as a nurse on the ward and then make some decisions with management. And I'm like, it shouldn't happen that way. But of course, I don't blame them that much, because that is how they have been operating without permanent nurses. So it took us some time with several conversations here and there, and then they started understanding where we're coming from, and then it further made the work a bit easier. But it wasn't as easy as I'm saying it when I started, and because of that, some of my colleagues couldn't even stay on that role. They have to leave to another place to work, and they were always stressed out. But I learned the hard way, and later it yielded the result. The patient were happy, so I got one of the patients who left that service to another service. And interestingly, for about 3 months, he wasn't cooperating with the new service, and he was constantly mentioning my name, to the point they had to arrange a meeting for me to explain to them some of the things that we did. And this is an adult learning disability patient who does his things, in order. He doesn't mess up with it. So if you don't know how to work with him, you're going to struggle, get him to remain settled most of the time. And they have to arrange a meeting for us to explain what we did. And they were so happy sharing the experiences and supporting the patient to now settle in properly in the new service that he was transferred to. So that is some of the challenges that I did encounter in my previous service. It wasn't easy, but then, it was worth it. And the opportunity was that I was able to also school at the same time. So whilst I was working, that was when I took the advantage to do my master's. And that also helped a lot to understand the UK system, and also to add or increase in my knowledge in terms of mental health and things that I could do differently even within the UK health services. So that was it at the time.
Thanks for sharing, Ebenezer. So you moved into your education as well at that time. Being an internationally, you would have been an international student by then, isn't it?
Yes, I was an international student.
And having your undergraduation from Ghana and having a master's in the UK. How was it? How was the transition of your educational journey?
It was, I would say it was different. So in my BSc, I had I got a first class from my program, and mostly our exams was our assessment was mostly of you learn, you see the exams, and then you pass it. So I wasn't so much used to assignments, writing long essays, researching and stuff. For my BSc, what mostly happened in most of my exams, and that was how I was being trained back in the years. You were given the model handout or content or the books, you study, and then you get either a theory exams or an MCQ exams, and then you answer. So when I was doing my master's, initially I was struggling a little bit, because I was now introduced to different forms of assessment, which I wasn't used to. So it took me a bit of time to, and I remember in one of my models, I have to resubmit because I didn't do well. Because it was the time I was actually struggling to, and I was working at the same time, schooling. So I didn't have, the time, the full time to be studying, and you need to work to cater for your bills and stuff. At the same time, you want to pursue an education or whatever. So you still needed to balance that, and the stress from working, coming from a 12-hour shift, having an assignment to do, and not being familiar with the method of assessment in the UK setting was quite challenging. But thankfully, yes, I did it, and I learned the hard way through it. And after the program, I realized that, okay, I've gone through the hard way, but I've gained another level of experience, which to me was very much beneficial.
Okay. So then, what made you to move into academia after this?
So academia has been something that I'd always dreamed to be. When I got into mental health, I realized that I was more of my interest and my passion was more into education, awareness creation, sensitization. And when I step into that role, from direct clinical care on the ward to the community, where I was mostly in the schools, in the radio stations, on the TV programs and communities, I realized that I was much joyful, and I had the satisfaction when I've given out information and the people feel like the knowledge they've gained from that session would change their life. So for me, I felt like, okay, I'd rather do much better educating people than delivering direct clinical care. So even back in Ghana, I was doing part-time teaching in the university that I actually trained in. But then I didn't have the qualification, so I wasn't a full-time lecturer. But they had actually used me on several occasions to teach their students and to make some presentation, and also to even develop their curriculum for one of the programs that they were introducing. They were introducing diploma in community mental health nursing in that university, and then I had gained the experience working in the community, so they have to count on my clinical expertise in developing that curriculum for the student. So when I moved to the UK, I felt like, okay, it's an opportunity. I will do my master's, progress, and then get back to academia. And even when I was in the UK as well, I was also training international nurses who had come to the UK to do their OSCE exams.
Yeah.
So I was an OSCE trainer. Some of them I was doing it even in my free time, wasn't being paid, but I was volunteering my time to teach the nurses, and they felt much better. Some of them went to the exams and they were like, oh, if not the training you gave us, we wouldn't have passed. So education was something that I'd always developed a passion to. And when I got opportunity in Salford, I was like, okay, this is the right time for me to now get in. And it's been an amazing journey. And I always love doing that. Even back in the university, sometimes my colleagues will gather themselves when they find it difficult to understand a particular topic that the teacher has taught. They will gather themselves and then they will invite me to come and then explain it further. And I realized that whenever I did that, they really understood and they were happy. So I felt like I am more into that than into direct clinical care. And of course, the knowledge and the experience from the ward has also made my journey in academia much easier. So, for instance, in the classroom, when we are talking about issues about mental health, I have the experience, I know what it is. So it's easy for me to explain to them and even share my experiences. And I could see most times the students are able to relate to those practical experiences, and it helps them understand the context better rather than trying to understand it from a point which seems like an abstract or which seems like they need to. But if you are giving them examples and sharing your experience with them, they are able to relate much more, and it helps a lot, making things simplified and easier for the student as well. Yeah, so that has been it.
Yeah. So, I can see that when they see themselves in us.
Yes.
I think it creates a mutual connection between
Absolutely.
the students and the the academics.
Absolutely.
So you, from your vast experience of working internationally and your education background, what do you bring into the education system for nursing here, and what role do you think you play in decolonization of nursing curriculum?
Thank you. So, as you know, we have a lot of international students coming into the university to study nursing. And the UK population currently is a mixture of different people from different culture background. So if you want to train nurses who will fit into the job market, then you need to look at diverse people from all sort of background and training people to culturally understand and be able to relate with the people that they're going to work with.
Yeah.
That is the first thing. So coming on board as an internationally trained nurse and having the experience in the UK, it has given me the opportunity to, first of all, share the experiences that I've gained both outside the UK and within the UK with my students, which I believe most times they're able to relate with. Mm-hmm. The other thing is that for the students, seeing you as an internationally trained nurse teaching them, it also inspires them. And it breaks that barrier of them thinking that, okay, I cannot do this, I cannot do that. If they have seen you working on the ward, progressing to that level, it motivates and encourages them to also know that, yes, we can also do that. And they're able to relate much more better. And if you are talking about culturally sensitive matters, I've experienced it myself. I've gone through some experiences that are not so good. The so good ones are there. So sharing it with them, how I did manage to overcome those challenges, even starting my journey with my first service in the UK, talking about the culture background, talking about the language barrier issues, talking about you fitting in the system. With those experiences, it inspires the student and make them feel at home, and also encourages them to know that, yes, we can make it. And when they get to the ward, as I'm saying, they will know that it's not one set of patient that they're going to look after, but whoever that they meet, it's motivate them to now know and try to understand their background and to work with them. So I think that with my background, with my experience in academia, and looking at the category of student that we are training now, it's rather appropriate for us to be there to support them to understand what the job market is, how the ward settings are, what the cultural issues are, and so they will be able to have that understanding and deliver their care as is expected of them. And it's been a positive experience relating with students from different backgrounds, trying to support them to understand. And sometimes, like you are saying, we have some of the master students who had been trained in a different country with a different educational system. And sometimes I use myself as an example, like I'm telling you, when I did my BSc, our assessment was different. But when I came here, I struggled. So sharing those experiences makes them more it relates to their experience as well, and feel like, okay, what we did in our country was different, but here you got to do A, B, C, D to help you adapt to the UK settings and to be able to progress within your career or your education. And it's helped a lot of the students a lot to now understand and know what to do. And the experience that we share with them helps them make much progress. So I would say that is my contribution in helping decolonizing the curriculum for the student and to support them in their journey.
Thank you, Ebenezer. So what advice would you give to future nurses or to your younger self?
So I would say that nursing is a noble profession.
Okay.
It's been the loveliest job and interesting job and I've never regretted being a mental health nurse. Okay. I will be biased here to say that mental health nursing is more interesting. Future nurses, the young ones who are coming in, nothing is more satisfactory than you going on the ward, supporting the patients. There was one patient that some years ago, we just supported him to make a cup of tea. He's never been able to make himself a cup of tea in his life. And we cannot imagine the smiles on his face that day. We literally went around making cup of tea for every single patient and staff on the ward. And he was so proud of himself. Imagine how the feeling was for you supporting this person, just to boil the kettle, just to put in the tea bags and to stir it up and to add a milk. You might think it's just something very little, but it went a long way to make so much impact and brought smiles on the patient's face. this is what you can do to support people. They need us. They need us to speak to them. They need us to encourage them. They need us to understand what they are going through and to make them live a better quality of life. So the younger nurses out there, see yourself as somebody who is putting yourself out there to put smiles on people's face and to support people. And once they do that, you have that satisfaction in you. It's not just about the money, but it's about the impact that you can make in people's life. And when you do that, I believe that it's much more fulfilling and rewarding than anything else. So the journey to become a nurse might not be easy for them. You need to do your academic work, you need to do your practice and all that. It's quite involving. However, the end result is quite fulfilling. So they should be encouraged to do what they love doing. And once they do that, they will never regret. Thank you.
Thank you, Ebenezer. I've got a set of rapid fire questions for you now.
Right.
Before we wind up. So is it a coffee or tea before a lecture session?
Sorry, didn't get
Is it
that.
a coffee or a tea before a lecture?
I'm a coffee, I would say.
Okay.
Yeah.
Are you an early bird or a night owl?
Early.
Okay. Thank you. If you could teach anywhere in the world, where would it be?
I would so say UK. Yeah.
Okay. What's your go-to stress reliever after a long day?
Well, I just listen to music just to, make me relax. Yeah.
If you weren't a nurse or teaching nursing, what would you be doing now?
I would say I would have still gone back to my laboratory scientist because I had a passion to do that.
Okay.
So I would have probably been a lab technician
scientist.
or a laboratory scientist. Yeah.
Okay.
Yeah.
And one thing you love about teaching nursing?
So when it comes to sharing experiences, and I remember some of the things that have happened to me on the ward and all that, it's quite exciting reflecting on those experiences and sharing with people and telling them that, you know what, if you do this, you might end up being involved in maybe an incident or being or supporting the patient to do that. So when I share those experiences, it's so exciting for me in class, remembering years ago what happened to me and sharing that experience and advising them that, okay, you do not need to do that. If you do this, I learned the hard way, so you should not learn the hard way. Go and then do the other way. Wow. And that is much more exciting for me in my teaching.
It's sharing your experiences.
Yeah.
And one thing you would want to change?
I would say, is it in academia or just?
Nursing or in academia?
Well, I would say that to give people the opportunity to start with nursing and then now identify where they want to specialize. Okay. I know it might be a little bit complicated as per how the system works, but there are people who on their first placement feel like, no, I don't think adult nursing is for me, I don't think mental health nursing is for me, and they want to now switch over to something that they would do. So I was trained, first of all, not as a mental health nurse, but my first 2 years was actually being trained as a adult nursing. I did obs and gynecology, I did pharmacology, I did surgical nursing, and then I specialized in mental health. And then it gave me much more comprehensive knowledge about nursing. Even before being a mental health nurse, I knew what to do if I were to be on the obs and gyn wards, if I were to be on a surgical ward. So I would say that if that is being done, if I have the opportunity, I'll probably change that to give people the opportunity to learn everything from the basis, and then as they progress, they now divert into their specialty, and that would help quite a lot.
Yeah, I can relate to you because you know I've studied the same way as well, where I studied, you know, children and young people's nursing, maternity nursing, so mental health nursing. So it's a registered nurse and a registered midwife at the end of the 4 years. So that's a wonderful insight. Thank you very much, Ebenezer. Thanks for coming in.
Most welcome.
Thanks for sharing your inspiring journey. I hope you inspire more and more future nurses into mental health services. So good luck with everything you do.
Thank you.
So you are listening to Nurses Beyond Borders podcast series with your host, Joshi.